Hello, Jessica Bockler here from the Alef Trust, and today I'm in conversation with Dr. Hennie Geldenhuys from South Africa. Hennie is a medical doctor and a clinical researcher and academic and a transpersonal coach. And Hennie is very passionate about holistic and spiritual approaches to health and well-being. I'm very pleased to say that from February this year, he'll be running a course at Alef Trust exploring integrative medicine. So welcome, Hennie.
Thank you.
Good to be talking to you today. So I'd like to frame our conversation a little bit, just with some initial thoughts, and then we can build on those, and I have some questions for you, and we can dive into the meaning of integrative medicine. Now, when it comes to modern medicine, we've got a lot to be thankful for. Allopathic medicine has saved millions of people from death and disease. I think there's no doubt about that. And at the same time, our medical systems that we have evolved seem somewhat incomplete and mechanistic, sort of failing to take into account the whole person or the larger context when it comes to the diagnosis and the treatment of illness. And I think, Hennie, you and I and colleagues in the field of transpersonal psychology and allied areas, we believe that we need to evolve approaches to healthcare that are not only person-centered, but really holistic and integrative. So I'd love to explore that with you today, why that means what that means and why that matters. So perhaps the first question to you, Hennie, what is integrative medicine for you?
Well, it's not the easiest question, is it? Because it depends on who you ask. There's no standard definition, and what many of us tend to do is we tend to interpret that question according to our background. So plenty of my colleagues, when you ask them what is integrative healthcare, my medical colleagues, they would frame it in terms of the physical body, or they would frame it in terms of biology, and say, well, it's when things like emotions and thoughts influence the bodily processes, which is sort of only partly true, but only part of the truth. If you were to ask psychologists or even some transpersonal psychologists, they might focus more on the spiritual aspects or more on the emotional aspects, the mind aspects, and tend to downplay the role of the body, which is also not ideal, because after all, we are physical beings, we have physical bodies, and we exist in the world as physical beings. So my view of integrative healthcare is much wider. I would like to think that it's cross-disciplinary, firstly, but I would also like to think that it includes a range of disciplines, including psychology, including medicine, physical medicine, but also including people like transpersonal coaches, people, spiritualists. I would like to think that integrative healthcare is the coming together of various disciplines, and this is why it's such an exciting area in which to work.
I've noticed here in the UK, where I'm based, the kind of psychosocial is coming more to the fore in healthcare. And that's really promising to see. It's sort of balancing out the biomedical approach to health. And at the same time, it doesn't feel complete. So it seems to kind of take into account the kind of more social context. You also mentioned kind of psychology. That's coming into play more, which is great to see. But what seems left out still to a degree is a kind of more broader spiritual and ecological acknowledgement of life, or the kind of wider web of life. I'm wondering if you could speak to that a little.
Yeah, no, absolutely, I agree. And it's also, I suppose it's because of the traditions from which we come, and it's very difficult to embrace new paradigms. So we tend to shy away from sort of big picture concepts. And particularly in medicine, we want to break things down. It's a reductionist approach, isn't it? So that they are easier to manage. We like to make a diagnosis. We like to put it into a label or a package so that we know what we need to do. And there's this almost inherent discomfort with the unpredictability in a way, and the wide open space of spirituality, whatever that might mean to you. So we can't ignore that in how we treat our patients or how we approach health and wellness. And yet we seem ill-equipped for it because we need that paradigm shift. We need to sort of move away from that partitioning off certain disciplines and saying, well, this is not really my problem, this is someone else's problem. But the problem is the next person says the same thing. So it's because we have to, as practitioners or as coaches or as doctors, we need to reposition our whole life view in a sense. Because if we have a slanted view of what existence is, that ignores things like spirituality, for example, then we're sort of missing key elements of what we do.
I completely share that view. And then I'm curious, you're based in South Africa, you're practicing in South Africa, Cape Town, right?
Right.
A question that's forming in my mind there is how the kind of medical practitioners in the mainstream might or might not interface with practitioners who are perhaps working within indigenous paradigms.
Yeah.
So then we're really talking about, indigenous practice, shamanic practice.
Yeah.
What place would something like that have in healthcare?
Yeah. Well, there are some interesting developments. Of course, traditionally in South Africa, like in many other parts of the world, there are still different silos, but there are some really interesting conversations going on about, for example, how traditional healers can work with and even within the same system. Because of course, what tends to happen is that we work against each other. Typically, for example, I can think of many cases where I've seen patients who are pretty ill, who are sort of at the end stage of their disease process, although they've already been treated by traditional healers, not because there's anything wrong with the traditional healing, but because perhaps other forms of treatment were more appropriate at the time. And that, of course, nurtures this antagonistic attitude. In the same way, I'm sure that many traditional healers have come across clients that have been let down by the traditional Western medical approach to medicine. And there are some really interesting conversations going on. And I think the more that we talk to each other, the more we realize that in fact we are very close. Our roots are actually closer to each other than we realize. We all come from a healing profession. Our intent is the same. I have this vision where it's one and the same, where we're looking at different aspects of the same paradigm.
As you're speaking, I'm curious to know, how would you deal with the suspicion that comes from the more mainstream clinical medical practitioners? Because this is taking us into territory that many people frame as New Age, right?
Yes, exactly.
New Age, woo-woo. It's not evidence-based. So how do you deal with that?
Yeah. Well, firstly, I don't think it's entirely true, of course, to say that it's not evidence-based. I mean, we know that, but to a lot of my colleagues, they would say that. And of course, that's not true. So one can engage them on that level. There is plenty of research. There's plenty of data that demonstrates very strongly the link between mind, body, and spirit. So one can engage colleagues on that level. But I think it's also exposure to something much wider. It's exposure to things like spirituality, mindfulness, the transpersonal. And it's my experience, in fact, that we aren't actually that far apart. If you do the effort to just have that conversation, explain to them, for example, what is transpersonal approach or transpersonal psychology, they're actually very eager. They're actually hungry for that information. And very often it takes a small shift in awareness to open up a whole new world. So we don't need to reinvent the wheel here. I think this is a question of exposure. It's a question of being willing to engage without in turn feeling antagonistic, or, when a colleague says to you, well, this is all rubbish, this is all new age stuff, to go past your initial defensive reaction and say, well, okay, let's talk about this. And we'll probably discover that, in fact, we are much closer to each other than we realize we are.
I would agree with you. I'm reflecting on my own experience of working in the mental health field here in the UK, and the strive to, that there is a strive now to set up projects that are much more holistic, certainly integrating meditation, because that has come so much to the fore in recent years and has been validated so much by so much research. But also that interest and curiosity by many healthcare practitioners and the desire to really see the patient or the person behind the patient role. And yet doctors seem so constrained, in their day-to-day practice. So they have maybe 10 minutes with a patient to kind of meet the patient, kind of gather information, make a diagnosis, and move on. So I think, medical practitioners in UK surgeries seem really at the sharp end there. But then the medical field is much wider and broader, and if we're working within public health, for example, we can look at the preventative end and already there begin to map out more holistic projects that consider a whole community within which an individual is embedded, and how the community is affecting their well-being.
Yeah.
So,
and when I speak to colleagues, they're very much open to this idea, because particularly when you work in general practice, I was a GP for many, many years. There is this inherent frustration that we sometimes have. And my theory is that a lot of my colleagues are not burnt out because of the working hours or the working conditions, which is a factor. What's more frustrating for them is this sort of intuitive knowledge that there's more going on beneath the surface than we've been trained to cope with. And we feel that we don't know how, and we don't have the tools with which to approach all those other things that are going on beneath the surface. So there's an eagerness, I think, for colleagues to just know more, and it's like a sense of relief, saying, I've always sort of, I couldn't really speak to it with my mentors, with my colleagues, but now that you mention it, yes, this is like a huge burden taking off, that someone else is thinking about this, the fact that I wish I could treat my patient or my client more holistically, if only I knew how. Another misconception is that you need to change your practice completely. There's a lot that you can do, even in a 10 to 15 minute consultation, if you have the right attitude, if you are open to certain things, if you are listening carefully to certain cues. You needn't change your practice dramatically. If you've been exposed to some of this stuff and had the opportunity to engage with it, think about it, practice it, then it's as if your practice changes all on its own, and you just become a better healer.
Yes. Here in the UK, we have something called the medical humanities, which connects medical training with education in the humanities, in the arts, drawing on creative practice in order to bring the doctor-patient relationship into medical training, looking at presence, looking at ways we listen, looking at ways we can take note of patients' stories, so that medical training becomes a kind of training of the soul and of the heart as much as of the intellect, So it's not just about learning about the physiology, how the body functions, but it's medicine is really much more, right? It's about the relationship and about attending to the needs of the heart and the soul.
Absolutely.
Yeah. If I could ask you actually then, in terms of the course that you'll be delivering, could you map out for us what you feel will be some of the kind of core priorities that you'll be addressing?
Yeah. Well, I think I would like to think that our approach is pragmatic and useful and not only theoretical. So I would break it down, and I think one would need to start off by thinking about some of the mechanisms through which this mind, body, spirit integration actually happens. You know, we are in our physical bodies that have biological processes. So what are some of these processes that in a way explain or try to explain how this integration actually works? And there's some really interesting science behind it that I think a lot of my colleagues don't know about. So I think it's important to not only think about the spiritual paradigm or the transpersonal paradigm, but to think about potential mechanisms. So things like psychoneuroimmunology, for example, or the psychoendocrine system, to think about how these systems integrate, what are the patterns in a way of this mind, body, spirit integration? Because if we can start to understand how that integration happens, even down to a molecular level, and not only on a spiritual level, then it becomes easier for us to incorporate that knowledge into our practice. So there would certainly be a section talking about some of those mechanisms in a way. But there would also be a section talking about how this actually looks in practice. So a lot of my colleagues would say, no, we see so many patients or clients, if you happen to be a coach or a psychotherapist, where there are these physical complaints, these body complaints, physical symptoms and signs that we know can't be explained by conventional medicine. So I would like to explore that on this course, those typical so-called psychosomatic conditions, which is a very, very interesting field, right at the sort of interface between conventional medicine and the transpersonal. So I would like to workshop some of those conditions so that we can get to know what we are dealing with. And then, of course, we would need to start integrating this and need to start thinking, so how can we integrate this into our practice? What does it mean for our approach to medicine, health and wellness in general? How do we need to change ourselves? How do we need to change the system? And what sort of interventions might be available for us to validate this type of thinking that we've just been talking about?
That's fantastic. Thank you very much, Hennie. I mean, maybe just to round off our conversation, I'd love to invite you to share your vision of what an evolved healthcare system would look like that has, that is truly integrative. So if you could share something of your vision, that would be wonderful.
Well, it would be a system where we don't need to have this conversation because it won't be an issue, will it? But my dream is for students in all disciplines, medical students, but also the allied health disciplines, but also, of course, coaches and therapists, to be exposed to this stuff at a very early level. I would like to see students talking about integrative health, about students being exposed to things like mindfulness or energy healing, or at least talking about it, understanding it so that it's not a foreign concept. I would like to see a lot of my colleagues attending workshops and conferences and having conversations, being exposed to some of these techniques. I would like, as we go through a course on any other training course, that we would go through a course where we practice these techniques of integrated medicine, integrated healthcare. And I would like to see this discipline, this scientific discipline, become more mainstream so that we have opportunities for further research, so that it becomes part of our thinking, so that we can't really think about medicine without thinking about the complete aspects of who we are as human beings.
Thank you, Hennie, for sharing your expansive vision, which I find very exciting, and I completely share your vision regarding the kind of more engaged conversation, bringing people together and being allowing and permissive to bring in these what's seen as more maybe fringe perspectives. I really feel that the indigenous, the shamanic elements have very much something to offer and to bring to the table.
Yeah.
I want to thank you for your time, and speaking directly to those of you who are watching this video, if you'd like to be part of the conversation, then feel free to come to our website, join Hennie's course, take a look on our website, all the details are there, and if you have any questions, please feel free to get in touch. Thank you, Hennie.
Thank you.